Yeah, so a lot of people have questions about our anti-obesity medications. How do they work? And of course, it matters which medication that we're talking about. When we are looking at older medications like metformin, which is not technically considered an anti-obesity medication, but it is a medication that improves insulin resistance, which can be a big driver of obesity. That is a medication that helps to improve the insulin blood sugar response so that we no longer get big spikes of blood sugar and we no longer get big spikes of insulin, which tends to drive increased hunger and increased fat storage in the body. So when we add a medication like metformin, we are helping that metabolic pathway to improve, and that can often lead to weight loss, although it is a more subtle effect than some of our other medications. We have a variety of medications such as phentermine and lisdexamfetamine or Vyvanse. These are stimulant medications similar to our ADHD medicines that reduce appetite. So they're not working on any metabolic pathways. They are simply reducing appetite, reducing food intake, which can lead to weight loss. Lisdexamfetamine, which is also called Vyvanse, is the brand name. That has been approved to treat binge eating disorder. So people who really struggle with recurrent episodes of overeating, often feeling a lot of shame and physical discomfort afterwards, eating very rapidly, eating to really numb out. That's where lisdexamfetamine or Vyvanse can be really helpful. Our GLP-1 medications and GLP/GIP medications, so semaglutide, which is Ozempic and Wegovy, or tirzepatide, which is Mounjaro and Zepbound, these medications are working on multiple different pathways. So they are slowing down the gut. When they slow down the gut, that means that we feel full faster when we start eating, and we also feel less hungry in between meals. So if we're less hungry between meals and we're more full more quickly, then we're going to be eating less calories, and that is going to lead to some weight loss. They're also working on improving the insulin and blood sugar. So they're working on the metabolism. That's why we use them in diabetes, but that's also why they can be very, very helpful in the treatment of obesity because they are working on that metabolic pathway as well. So when we reduce big blood sugar spikes, when we reduce big insulin spikes, we are having an improved insulin sensitivity, and that is also decreasing hunger and decreasing fat storage, also improving the health of the liver. When we are using these medications too, a lot of people will tell you that they think about food a lot less. So their food chatter or food noise goes way down, their cravings go down. A lot of people will tell you that they're not as interested in their sort of snacky or junk foods that they've often turned to, and they're more interested in eating fresh foods. People will say, I just kind of feel like having a salad. I don't really feel like having those chips. I have a bite of my favorite dessert, and after a bite or two, I felt satisfied. So it's a very different experience that people have, especially if they've been emotional eaters, if they struggle with food addiction, binge eating disorder, or disordered eating in general. They often find that just their interest and desire for food goes way down without food becoming gross. So if we have reduced hunger, if we have improved the metabolic pathway, and if we're not thinking about food as much, we've got three different mechanisms that are helping with weight loss. Additionally, as we're seeing in increasing studies, they are also working behind the scenes on other parts of metabolism that have been affected, which is why we're seeing improvements in heart disease, in sleep apnea. There are studies going on right now that are looking at chronic kidney disease and fatty liver disease. A lot of these diseases that for such a long time we've seen as really separate, but are really wired into the metabolic system.